Greetings, everyone. My name is Xavier Hernandez. I am the Diversity Education Officer in the Office of Health Affairs for the College of Health Sciences. And today I am so happy to be joined by Dr. Shruti Gohil, who is an assistant professor in the Division of Infectious Diseases here at UCI. Dr. Gohil, thank you very much for joining us today. We're here to talk about the topic of diversity, equity, and inclusion, which has really permeated every aspect of our professional and personal lives over the past year, during the pandemic. So please share your thoughts on what do diversity, equity, and inclusion mean to you?
Yeah, I think, actually some of the topics that I talked about really underneath all of that is the idea that if you take context into account, any human being, no matter what culture they're coming in from, what sort of their life experiences have been in their within their, say, gender, or within their ethnicity, all of those things have collateral impacts on the way you frame your life, the way that you understand things that happen to you, the way that you are going to respond to them. And because of that, I think that it's absolutely critical that we understand our patients in their context. And that context could have many different sort of ways that you might define what that context is. And so for me, for example, when I meet a patient, one of the first things that I am thinking about is their sort of cultural or, what kinds of exposures that they may have had that frame the way that they're going to be able to tell me about their illness on the one hand, and also be able to take my recommendations as well. And so I think it's absolutely a fundamental way in which we try to understand every human being and the diversity that people bring to us, seeing both the commonalities in that diversity as a lived human experience, but at the same time, being able to find out what's different enough that we can help each other understand each other better. And so that would be the diversity part of it. The inclusion part of it, absolutely critical, because the way in which we cross-pollinate our lived experiences with each other, no matter what direction we're coming from, then that inclusion makes us all richer, and it provides us with a way to relate to each other and be inclusive of each other. And I think I've answered what. Did I leave anything out?
Equity.
Equity. Right,
well,
okay,
yeah.
Equity. Sorry. My apologies. I don't know if that can be edited out, Will, but equity. That's right. I think that the constant that I see in between every patient and every human that you meet, that idea to see the diversity, which highlights the differences that we have, but the similarities, that's where I think you define equity in a way that is critical, and to take everybody as an equal partner and player in life, in the work that we do, and know that everybody who participates and who has a voice on something is really giving you something important, and that equity is really, without that, I don't think we have a society in which we can really move forward. Progress is dependent on this issue of equity.
Great. Thank you, Dr. Gohil, for sharing your story with us today. And we thank you very much for being a champion of diversity throughout the UCI campus community. And we look forward to all that you will continue to accomplish in the